health issue, and it is not talked about enough.
Let's look at some of the fears that women go through for cervical cancer screening. So most of the time women fear the procedure, and the procedure is not so painful. Remember, we are using visual techniques whereby we need a woman to undress in front of a health worker, remove the undergarments because the cervix is hidden inside there, inside the vagina. We cannot just see it. So we do what we call speculum examination, where we insert a small equipment in your vagina to see the cervix and then apply a reagent to see whether the test is positive or negative or suspicious for cancer. So you don't need to fear the speculum examination, or the procedure for examination is uncomfortable, but it's not so much painful. Just little discomfort for a short time, and then we are able to know if the cervix is normal or is having a problem. Other women fear getting to know about the results. And yet, this is very important because we need to know the results so that we can know which kind of a problem we have. Do we have a precancer or a cancer? Remember, precancers are managed there and then they can clear within the shortest time. For the invasive disease or for the cancers, we are supposed to remove a small tissue, sent to the lab. The lab person will tell us if it is cancer or any other diseases, because we also have other diseases which can cause wounds to the cervix. Some other women fear about the treatment itself, and the treatment is never so painful. For example, for precancers where we do thermocoagulation, these thermocoagulation takes a very short time, where we treat the precancer, remove it from the cervix so that the cervix does not progress to cervical cancer. So it is a simple technique where we apply some little warmth onto the cervix to remove the precancer, and then it takes a very short time, that is only 1 minute, and then you will be fine. The precancer will go with the time, and we are sure it will clear, and then we shall call you back for review to check on your cervix to see if really the cervix has healed. So those women with invasive disease, or those women who already have wounds on their cervix, we are supposed to remove a small tissue. And once the tissue is removed and the results come back when it is a cancer, then we are supposed to start the care or management of this cancer. If it is possible to remove the uterus, we just get in touch with the gynecologist or the gynecologist, who will be able to remove your that bad uterus with the disease, and then you stay okay with your good life. If it is really advanced and you need to go for radiotherapy or chemoradiotherapy, then we need to get to know the results so that we can refer you to the best people who can offer you the best care.